Describe how blood flow, blood pressure, and resistance interrelate. Blood flow, blood pressure, and resistance are intricately connected and together determine how effectively blood is delivered to tissues throughout the body. Blood flow is the volume of blood moving through the vessels per unit of time. Blood pressure is the force exerted by blood against the vessel walls. And resistance is the opposition to blood flow, primarily caused by friction within the blood vessels. The fundamental relationship among these factors is often summarized by the equation analogous to Ohm's law in physics. Blood flow equals blood pressure divided by resistance. This relationship highlights several important clinical points. Blood flow increases when blood pressure rises if resistance remains constant, or when resistance decreases if pressure is constant. Conversely, blood flow decreases when blood pressure drops or resistance increases. For example, when blood vessels, especially arterioles, constrict and become narrower, resistance rises sharply. If the pressure generated by the heart remains the same, less blood will flow through those narrowed blood vessels, which can result in tissue ischemia or organ dysfunction. On the other hand, if the heart pumps more forcefully, raising blood pressure, blood flow to tissues increases, assuming resistance doesn't also rise. The body constantly regulates these variables through negative feedback and compensation. During exercise, blood vessels supplying active muscles dilate, decreasing resistance in those areas and allowing more blood flow to meet increased metabolic demand, even if overall blood pressure remains relatively stable. In conditions like dehydration, the blood becomes more viscous, increasing resistance. The body may respond by increasing heart rate and constricting some blood vessels to maintain adequate blood flow to vital organs. Clinically, this relationship is critical in understanding disease states. Chronic high blood pressure or hypertension can be the body's attempt to overcome increased resistance, such as that caused by narrowed or stiffened arteries in atherosclerosis. Over time, this compensation can damage blood vessels and organs, leading to serious complications like heart failure, stroke, or kidney disease. Clinicians use this understanding to interpret patient vital signs, manage conditions like hypertension and shock, and to develop effective treatment plans.